Has the healthcare crunch in Canada made you more likely to disregard some minor health issues?
No, not at all. All right, I'm a big advocate of our healthcare system. It's been great for my family and I. I think I might be. I'm not sure if I'm in the minority or majority, but in terms of where we are in Canada, I'm a big fan, and I can't say anything bad about it.
Very much
Yeah,
so.
oh yeah, definitely.
It's hit both of us, absolutely.
So I know we don't do a lot of things and go to, like, it takes 2 weeks to get into a doctor, so sometimes the issue that you have is just, it's gone by then or it's not important anymore. So.
Yeah, and that's happened to us recently, so
Yeah.
absolutely.
Sometimes, yeah, like for me, getting into my family doctor, you always have to plan 2 weeks in advance. So if you're actually sick, by the time you go see the doctor, you're not able to show them the symptoms, get the medical need you can get, or you have to go into a walk-in. On a walk-in, you're sitting there for a couple hours at a time, and if you're in pain, you don't want to do it. So yeah, you need a little bit more support there, I guess.
Well, even if you have a family doctor, it's like even just trying to get an appointment with them, like with my family doctor, it's like a month ahead of time. So it's like I need to know a month ahead of time if I'm going to have an issue that I need to go to my doctor for. And then ERs too, like if you have something urgent, I think a lot of people are like, okay, you know what, like weigh the odds, like can I handle this at home? Because I don't really want to wait, or I can't take the time off work to go to the ER for 14 hours.
I'm more on the other side of things where it's good that I'm not running to the emergency room for a hangnail kind of thing. You know, it's a little more clear on where I should be going and what I should be using the healthcare system for, not just abuse the healthcare system kind of thing.
I think that we need a lot of work in proactive medicine and care, right? I'm glad that we're healthy and we're young, but I do fear, you know, if I do have to use our medical system, what the experience is going to be like. So I think being more proactive is probably the best thing to do.
Yeah, I do find myself disregarding small things and taking it into my own hands because I know that the process to go and see a walk-in, I don't have a family doctor, the process to go see a walk-in or go see somebody can be a bit uncomfortable. Sometimes it feels like it takes a few levels for me to actually get to talk to the doctor. Sometimes it feels like a bit of a business. Yeah, it's not because it's not for any reason other than I consider myself competent and healthy enough overall that I can ignore certain things.
Yeah, more than likely. I mean, probably if it was something small, I would just either take it upon myself or I guess wait it out and see how it goes from there. But yeah, I suppose.
I live in Melfort, and there are a lot of family doctors there. Nobody's taking new patients, and I went to the ER for a sore throat, and I was there for 5 hours, and I couldn't even get antibiotics, so I just went home.
I am very privileged to have private medical insurance, and I live in another country, which is where that private medical insurance is obligatory. And the healthcare is much more responsive there, so I feel comfortable going to a doctor there. And when I compare it to the Canadian system, I feel less inclined to go to the doctor here because I know there's a big demand for doctors and maybe there's somebody else who needs it more than me. So I'll kind of let things pass for myself in comparison for others that I think need more than me. But also I know there's big waiting lines, especially since COVID.
I don't think so because, you know, our system here has worked for a very long time, and I think it could work better than it is now. So I'm not going to turn away from it just because I think it can't provide for my needs.
They say healthcare is free. We just spend 5 hours of our lives that we're not getting back. So it's not exactly free. And yeah, if it's a minor issue, then it's like, how much of my own time am I going to invest in waiting?
I've now lived in 4 provinces as an adult, so I've seen the healthcare system in 4 different provinces, and I'd say even though I lived in Newfoundland, which is by far the poorest province, but they spend a lot of money on healthcare, I would, my health is number one. I'm a mom, I'm a caregiver, I have to take care of my health, and I have to take care of my family's health, and I'm an advocate for my own health too. So it might be a bit tougher to get things done, but you have to advocate for yourself, even if it's a tough environment.
Yes, absolutely. I don't go anymore. I lost my doctor because he retired, couldn't find a new one. And where I live in Comox on Vancouver Island. You're waiting 2 to 3 hours sometimes just to see somebody. You can get there first thing in the morning at 7:30, wait half an hour, find out they're already full. You just don't do it. You just ignore it.
Probably, yeah. Yeah, I think there's a real health crisis going on, and if you don't have a family doctor, it's really, really tricky. And going to the emergency room is not ideal. And those doctors and nurses are doing everything they can, and they're working their butts off, and there's just not a lot of support for them, I find. And so, yeah, I think it's just easier to neglect some health issues than try and get in and see a doctor right now.